In case of a patient of hypertension with chronic renal disease such as glomerulonephritis, one has to think about the level of hypertension and kidney disease. In case of elevated blood pressure, the diastolic blood pressure is within normal limit. That is, 80 mm of mercury or less. But the systolic blood pressure is ranging from 120 to 129 mm of mercury. High blood pressure is again divided into stage 1 and stage 2. In case of stage 1 high blood pressure, the systolic blood pressure is 130 to 139 mm of mercury, whereas the diastolic blood pressure is in between 80 to 89 mm of mercury. In case of stage 2 high blood pressure, the systolic blood pressure is 140 to 180 mm of mercury, whereas the diastolic blood pressure is in between 90 to 120 mm of mercury. In case of hypertensive crisis, the systolic blood pressure is higher than 180 mm of mercury, whereas the diastolic blood pressure is higher than 120 mm of mercury. The goal of treatment is to reduce the blood pressure less than 1/138ths of a millimeter of mercury. In this picture you can compare the normal kidney to the kidney of glomerulonephritis. Glomerulonephritis is the inflammation of glomeruli. Glomeruli remove excess fluid, electrolytes and waste from your bloodstream and pass them into your urine. The normal serum creatinine level is 0.8 to 1.8 mg per deciliter. It is increased when there is kidney malfunction. The normal urinary creatinine clearance is 85 to 135 ml per minute. 24 hours urine should be collected to assess the renal function. It is decreased in case of renal function. In case of kidney disease you have to assess the albumin and creatinine levels in urine. In case of glomerulonephritis, there is hematuria, albuminuria and RBC casts in the urine. If the amount of albuminuria is less than 300 mg per day or the creatinine level is less than 300 mg per gram, then prefer the usual first-line medication. But if the albuminuria and creatinine levels are more than that values, then prescribe angiotensin-converting enzyme inhibitor. If the patient is tolerant to the angiotensin-converting enzyme inhibitor, then continue the medicine. But if the patient is intolerant, then prescribe the angiotensin receptor blocker.